everyone, I am Leeana and I am here at CSA. Today I'll be getting lip fillers. Previously, I had them done to correct the asymmetry of my lips, and now I'll be getting them again for hydration, volume, and subtle flip. I'll also be getting Ultherapy and Botox for a smaller, tighter, and contour face. Don't forget to like, subscribe, and hit the notification bell to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's welcome Leeana.
Hi!
So 3 months or 4 months ago, we have done a treatment called Botox. How was it right now?
Ngayon, Doc, lumiit talaga yung traps ko. At saka
Okay.
wala ng tension and pain sa
Good
trapezius
news.
muscles.
So it really helped, okay? So for individuals with problems on this neck area and shoulder area, particularly the trapezius muscle spasm, so that Botox can help you. And also we did some radiofrequency microneedling, but it was only like, we haven't repeated it yet.
Yes.
One time. But the thing is, because Leeana is always busy, and as a woman, we have this monthly cycle.
Yes.
Sometimes we suffer from acne. There you go. So we women also have this condition called hormonal acne, or of course even like the stressful lifestyle, overwork, getting this acne problem. When you wake up in the morning, all of a sudden there's a zit or there's a pimple. Forehead, cheek area, jawline area, or it could be around eyes, around mouth, or it's the others on the nose. Okay. So there are still like problems of acne, and she's still young, mid-20s, okay, 25. But I was telling Leeana, aging starts at 25, and yearly you're starting to lose collagen around 1 to 2%. Okay, so compounding the problem, instead of just be concerned with the acne, right, and the skin condition, and then you'll start to see some sagginess. Ayun.
Yes.
So she was telling me a while ago, she's noticing a little bit of like the going down of the tissues in the cheek area, in the lower third of the face, or jowls, okay. But I was telling her, you're still good, you're still okay. So at the age of 25, we may notice on our face, the others are saying, Doc, I'm starting to see crow's feet here. Doc, I'm starting to see a deep nasolabial line here, or laugh line there. Or Doc, I'm starting to see downturning of the corner of my mouth, or like some beginning jowls here. Some people are telling me that, okay? Apart from the concerns of the skin quality. And another thing is, for your age, you're also concerned with this lip area.
Yes.
The lip volume, the lip contour, the lip symmetry, the lip proportions. And especially you're also a model, right?
Yes.
You're into commercials or promoting products, something like that. So even the lip region is, you want to do something about it, improve it. If you're noticing like asymmetry, imbalance, or lack of volume, or lack of contour, you may want to do something about it. Because we did a treatment in the past, the
Yes,
correcting of lip asymmetry, but that was how many years ago?
Almost 3 years na po.
Long time already. But I was still seeing volume on your lips.
Yes po.
So I was sharing with Leeana the ideal proportion for the lip area, 0.8 to 1. Okay, so like your lower lip should be thicker, or it should have more volume. However, the upper lip should have 2 to 3 millimeter projection. And then you need to have that good contour. Plus, also, if you're noticing already a beginning kind of lip inversion, it's
Yes.
going inwards, you need to do something about it. Okay? Because that's already a sign of aging. The so-called lip inversion. The lost volume, the lost contour. The others are concerned with lines around the mouth. So, perioral wrinkles. Some people have these concerns, okay? The others are concerned with the downturning of the corner of the mouth. The others are concerned with the dryness of the lips. So, those kinds of problems, okay? So, of course, for lip improvement, lip enhancement, we do non-surgical treatment here, and we use the so-called hyaluronic filler injection, which we did last time. So, we'll do that again today, plus the anti-aging, the prevention of the aging. We'll be doing some Ultherapy, and also we're monitoring the masseter muscle. We'll be doing Botox. We'll show the procedure when we return. And we're back. So we're doing a procedure for Kim Leeana, and I just want to introduce a great friend of mine from United States of America, Dr. John Mark. Thank you so much for visiting Philippines.
You're welcome, Dr. Contessa. Yeah. I'm excited to be here in the clinic, especially seeing you after several months, right?
Exactly. So we're together with the American Academy of Aesthetic Medicine. So Dr. John Mark is practicing internal medicine as well as aesthetic medicine.
Yes.
So John Mark, we're here with Kim Leeana. She's just 25 years old. So we've already done lip enhancement 3 years ago. Right. So today, it's kind of like another lip enhancement, but still making it natural looking. And we were sharing with Kim Leeana about the ratios and proportions of the lips. Like, ideally, it should be 0.8 to 1 ratio. So you want your lower lip thicker than the upper lip. And the upper lip should only have 2 to 3 millimeter projection. Plus, we want also asymmetry and balance. Because last time, what we did was correction of the lip asymmetry, right?
Yes.
Yeah. And also restore some volume because, over time, we lose volume in our lips. And also like the lip contour. And a concern from Kim Leeana is that she's noticing her upper lip is kind of going inwards. So lip inversion, doc.
Right.
So we want to do kind of like a lip eversion. Or in the United States,
lip flip.
Lip flip. Okay, that lip flip. They either use hyaluronic filler or the others also combine with botulinum toxin to also relax orbicularis oris muscle because we have muscle here. Especially for patients with lip wrinkles already. And then when we're doing injectables in our classes, we review the anatomy. Like for example, what are the vessels around the mouth area. So we know we have here labial arteries from your facial artery. So as physicians, we know what are the danger areas, what areas are we avoiding. So as injectors, we have to be really equipped, prepared, knowledgeable, skilled.
Yes.
Yeah, especially we're doing the lips, okay?
We need to know our enemies.
I know, right? Yeah. Okay, and avoiding them.
Right.
So for Kim, she's just young. And it's for young people, it's enhancement. Still want to look natural. It's not making them looking unnatural, okay? We want everything within proportions, within balance, because beauty is symmetrical. There's symmetry within proportions and ratios, okay? Plus, we are Asians. Actually, I want to retain my Asian identity. Although, si Kim Leeana looks like combination Hybrid tong batang to okay? So for the lips, we did a while ago some topical numbing already. So my assistants already cleansed the area. They applied the numbing cream. They left it for how many minutes? 30 minutes, half an hour, right? So I'll be using my favorite. Actually, I use the Restylane Kiss for my lip area. So it's made up of hyaluronic substance with the right molecular weight, plus we call it the right rheological properties, viscosity, cohesivity, elasticity. Especially the lip, it's very movable. So you want a product that will also move with the lips. You don't want a product that's hard and immovable, otherwise. So we want something within the just the right material for the right anatomical area, okay? So I have here hyaluronic Restylane Kiss, and I have a gauge 27 needle. Usually what I do for my technique is I work on the outer border first, the boundary of the lips. So for example, the vermilion border, I still wanna give kind of a contour there. So in my technique, like the philtrum there, I'll pinch this upper lip here, a tiny aliquot of my product there. Okay. And just inject a little bit. There you go. Just a little bit there. And I'll follow the line here. So a while ago, they already numbed the skin, the lip area with our so-called numbing cream. And they also cleansed the area already. And then I'll just follow this and injecting just tiny aliquot. I don't want to overfill. We don't want too much of a lip, right, Kim? You just want the natural lips. You still need hyaluronic substance in your skin, in your face, in your lips, because this attracts water. So I'll just follow the line there. So I'll just do the half later on. For my lower part, because I just want to restore volume and some hydration there, this is already what I do. I start with the so-called lower lip tubercle. I pinch it like that and just inject like a 0.1 in this area to create the so-called lower lip tubercle. So for example, I'll place 0.1. Okay. So again, the anatomical layer, you want to stay on the outer area. Don't inject into the inner mucosal area. So you're just staying on the dry, we call it dry mucosa. I do the so-called tenting technique also here. Like I'll add another one here. So the others are calling it fencing technique or a so-called lollipop technique, okay? So I'm just giving tiny aliquot, okay? So that's it. A simple technique because her lips are still beautiful. You don't want too much, okay? You just want the natural one and you just want to hydrate also. Now, we mentioned a while ago about the upper lip. It's kind of inverted a little bit. So we want to invert it. The way to invert it is you can apply the so-called tenting technique or fencing technique, or even you call it lollipop technique. So what I do is from the border and then inject into the body, the vermilion, and just push a tiny aliquot. So for the right side, I don't want to inject too much because I noticed the left side will need more eversion. Right, Kim? She told me a while ago, we need to work more on the left side, okay? So this is just tiny, tiny aliquot. Okay. So just a small amount. So it's normal to have some pinpoint bleed there because we know the lips, it's hypervascularized. So I've done the right side, as simple as that. A simple technique, point by point, and then we'll be doing also a procedure for Kim Leeana right now, the so-called Botox, because I palpated the masseter. Like I've done this long time ago, right? So we need to kind of do it again. So palpate for this one. Okay, let's do some marking. So we'll work on the right side first. When you want to work on your masseter muscle, okay, you have to make your markings and from corner of your mouth to the tragus. The others are doing like from corner of the mouth to the lower earlobe. So this one is okay to the tragus. That's the superior border. Your posterior border is this part here. And the inferior border is just your jawline, the mandibular line. Now, the important part that you need to identify is the anterior border of your masseter. So ask your patient to clench. So Kim, clench for me. So once you palpated the anterior border, make a straight line like that. Then in my practice, I still have to make another 1 cm line lateral to it. And I cross this. The reason why I do this is because you have a rhizorius muscle from the corner of your mouth that inserts to the anterior border of your masseter. So you don't want to diffuse your botulinum toxin into your rhizorius. Otherwise, it will affect her smile. Right. Because if you inhibit your rhizorius, the smile will not be even. It's going to create a crooked smile. So now this is the area, the square. So turn to the left. So this is now the area that we can work on. Now for women, I always start with 25 units per side, okay? So for my injection point, I do either 3 injection points, 4 or 5 or even more. Since it's 25 units, I will divide it by 5. Then I'll have 5 injection points. 1, 2, center here, 3, 4, 5. So I'm just within the square. Okay, it's like a dice technique also. So like this is the angle of the mandible, you can go 1 cm above that. Okay, 1, 2, 3, 4, 5. So for every injection point, 5 units. Okay, so we can do that here now. So I'll get another, like, I'll get new gloves. So you can follow the markings. Then I'll use my botulinum toxin. So this is the 100 unit botulinum toxin. So I said that I'll give 5 units for every injection point. So for example, here. So you have to make sure you inject the entire part. The entire, like the masseter has a superior, inferior part. It's subdivided by a so-called deep inferior tendon. So you want to relax the entire masseter so that you won't have the side effect of paradoxical bulging, okay? So I'll go to this side again. You're okay, Kim?
Yes.
Okay. So I'll inject 5 units again. The center one. So we'll just continue injecting here and then here. So the goal of your botulinum toxin is to relax the masseter. And for women, of course, girls want the narrow bigonal width. We want a V contour, okay? So that's the goal here. So this is one of the treatment that we do to achieve a V face, V-shaped face. So I've done the right lip, I've done the right jaw tox. Another thing that I'll do for Kim Leeana is to treat the, she's telling me she's already seeing signs of sagginess. You can use our device called Ultherapy. So let's proceed to our Ulthera treatment. So this is an ultrasonic device. So it makes use of that ultrasonic energy. It has 3 target layers: your skin, your subcutaneous, and your SMAS. So the concern of Kim is like the sagginess in this anterior aspect on the jowl area and also the mid-face sagginess already. So I'll be using the 4.5 to target the SMAS. And then after that, we'll also target a little bit of the subcutaneous plus a little bit of the dermis fibroblast cell. Since I did an injection here, my goal is just to work on this one. I have patients who's concerned about having jaw tox. And since the muscle will be becoming smaller, right? Kinda it's gonna go inwards like this. Their concern is this part will be, like if they have jowls, they were thinking it's becoming prominent. It will become like more jowls because they did injection of this. So for prevention of the jowling here, you can combine with this treatment, Ultherapy, to create that lifting and plus restore collagen, right? So I'll just work on the jowl part and I also will work on the anteromedial cheek part, okay? So I'll just give some shots of 4.5, okay? So this is Ulthera. Okay. How was it, Kim? So you can deliver like as much as like in jowl part, you can give 30 shots depending on the severity of the problem. And since Kim Leeana is so young, not so really much, okay, just also prevention.
Yes.
Prevention is better.
Prophylaxis.
Yeah, correct. So we need this, John Mark.
Yeah, I think so.
I'll do this
early.
Exactly. So, we should be the models of our own center, right, Kim? Kim is already a model, so she's modeling like some products, something like that. Walk the talk. Okay.
At least once a year, you know.
Later, you have to do my Ulthera doc,
Yes,
ha?
I'll
Okay?
do it before I leave.
Exactly. So, we'll just proceed with this Ultherapy. So we're doing the last 2 shots of our Ulthera. We're on the 1.5 millimeter and we will be proceeding to the left side. have done the procedures for Miss Kim. We have done the lip enhancement, the Botox, and our Ultherapy. We'll show the result when we return. And we're back. So let's show the result to Kim. So John Mark, we're excited.
Yes, we're excited.
Wow.
There you go, right?
I really love it, Doc. Thank you so much.
And it looks natural. There's an instant result, right? And it blended well to her face.
Yes.
So the center of the face, center of attraction, the nose, the lips, the chin. She has a good nose projection, good lip projection, good chin projection. We call it the
proportion in the lips.
Exactly, proportions, the symmetry.
Right.
And now the Botox, we still wait for like around 2 weeks to take effect. And then also the Ultherapy. So that one, we give it like 4 weeks, 8 weeks, 12 weeks to still work. Okay, but the lip filler, instant.
Right.
Doc John Mark, comment.
I think you did a great job, Dr. Contessa.
Thank you so much.
I mean, we make it like more natural looking.
Yeah.
And also, and it's also painless.
Yeah.
I think patient comfort is also very important during
Exactly.
these procedures.
Because the Restylane Kiss, it has lidocaine with it.
Right.
There are some fillers that don't have lidocaine with it. And when they don't have lidocaine, we still have to give injections of lidocaine. Like, for example, like doing the infraorbital and mentalis nerve block. But for this one, we already have lidocaine. Because some people are saying it looks painful.
Right.
So with Kim, you experienced with the lip filler injection, some, it's tolerable,
Yes,
it's okay. You might be feeling a bit of the sharpness of the needle, but it's okay, right? Kim naman, anong comment?
If you're planning to get your lips done, this is your sign.
Exactly. Right.
Ang ganda talaga. Tsaka painless talaga, Doc. Siguro kung i-rate ko, it's just 3 out of 10.
Wow.
Yes.
Yeah. I did try that on myself.
Yeah.
Because some people have low tolerance eh. So like on myself, I can inject my own lips actually in front of the mirror. Okay, so I'll do that too. Thank you so much, Kim.
Thank you so much, Doc.
Doc John Mark, thank you.
Thank you, Dr. Contessa.
Yeah,
as
you're
well.
flying back to the United States.
Yes.
Let's do this in the United
Yes.
States,
You're
right?
welcome to come over to my clinic.
Yay! So mga ka-CSA, abangan ang next. So Dr. John Mark has a clinic in Arkansas. Can you share with us the address of your clinic?
Yeah, so my clinic, the name of my clinic is Embrace Eternal Beauty, Aesthetics and Wellness. It's going to be opened on March 18, 2025 in Hot Springs, Arkansas. So the address is 4332 Central Avenue, Suite H, Hot Springs, Arkansas 71913.
There you go.
Yes.
So mga kababayan na nasa Arkansas.
Mga kababayan, punta na kayo.
Right.
We're gonna offer some discounts for first few patients for a month.
Right.
And just check on our website, which is https eternalbeauty.com, and you're gonna see there our list of our procedures and many stuff over there.
Yeah, Kim and I will go there.
Yes.
Yes, ma'am.
So you'll see us. Yeah, tamang-tama because we have a lot of friends in the United States, and they're asking me whom to refer to. So we'll go to Dr. John Mark's clinic. See you there, guys. And our clinic too in the Philippines.
Yes.
Okay? It's located here, the Infinity Shop, Pulong Maragol, Angeles City. Our contact number 0933-860-9193 or 0917-504-4268. Our Instagram, CSA Medical Aesthetics, FB page, CSA Medical Aesthetics, and our email, csaskinclinic@yahoo.com. For our clients, our viewers who are still asking questions, you can just directly message us there. Okay? Si Kim, Instagram.
Yes, Kim Leeana DP and Kim Leeana po sa Facebook.
Daming followers, Doc eh. Yan. So those who have also questions to our yung mga nag-model in our YouTube videos.
Yes.
So Kim is also happy to share with you her experience, and you can really check her pictures sa kanyang social media and see her eternal beauty,
Yes.
the maintenance, the prevention, the prophylaxis, the anti-aging. So we want that. Okay. Doc Jan, thank you.
Thank you rin po.
Yan, Kim, maraming salamat po. Okay, and of course, to you all, thank you so much for always watching our videos, our YouTube channel, Contessa Salvador. Okay, God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.